So, what's the real deal with AI scribes? Are they this incredible new tool to relieve doctor burnout, or are they about to kick off a massive productivity revolution in healthcare? Well, health systems are betting billions that it's one, or maybe both of those things. And for the very first time, we have some real data on their impact. So, let's dive in. I want to start with just one number: 45%. Think about that for a second. What do you think that number represents in American healthcare today? Well, that's the percentage of U.S. doctors who are suffering from burnout. Nearly half. And I mean, this isn't just a small problem, it's a full-blown crisis, and it's really threatening the foundation of our healthcare system. The biggest reason why might actually surprise you. It's the paperwork. I mean, it's this relentless, absolutely crushing burden of administrative tasks that has doctors drowning in clerical work instead of what they should be doing, focusing on their patients. You see, a doctor's day doesn't just end when the last patient leaves the office. Oh no, for so many of them, that's when the real grind begins. They're facing this mountain of clinical documentation, they're managing patient messages, they're following up on lab results, and they're fighting for insurance authorizations. It's basically a second shift that just eats into their personal lives and fuels that exhaustion. Now, this problem isn't exactly new. For years, the go-to solution was to hire human scribes. And you know what? The concept worked. They saved doctors about 23 minutes a day on paperwork. But the model? It had a fatal flaw. It just wasn't scalable. Human scribes are expensive, and there just aren't enough of them to go around. So it proved that saving time was possible, but it was going to take a technological leap to do it for everyone. And well, that leap has arrived. Enter the AI scribe. This is technology's answer to what is, at its core, a fundamentally human problem. So what is it exactly? Well, to put it simply, it's an AI tool that listens in on the natural conversation between a doctor and a patient, and then it automatically drafts the clinical notes that go into the health record. No more of that awkward typing while trying to maintain eye contact. And the adoption has been absolutely explosive. Health systems all across the country are rolling this out at a massive, unprecedented scale. This huge investment, though, it raises the stakes and makes that central question even more urgent. What is the real, measurable impact of these tools? Fortunately, we don't have to guess anymore. We now have the first ever large-scale, rigorous studies that give us some real evidence. It's kind of like a tale of two landmark trials that paint a really fascinating and pretty nuanced picture. Okay, so this is where it gets really interesting. Let's break down these two key studies. On one side, you have what we can call a best-case scenario from the University of Wisconsin, and on the other, a more typical case from UCLA. Just look at the huge difference in physician usage: 71% in the best-case trial versus only around 30% in the typical one. Honestly, this one detail is the key to understanding everything else. And this chart just drives that point home. I mean, look at that difference. When you get a group of really enthusiastic early adopters to go all in, you get 71% usage. But in a more standard, everyday rollout, it's closer to 30%. Context here is everything because it dramatically changes the results. So what did they find? In that best-case scenario with that really high adoption rate, the time savings were impressive, about 22 minutes per day. That is a major achievement, putting the AI right on par with the time saved by a virtual human scribe. But, and this is a big but, in the more typical scenario, the results were more modest. Here, doctors saved somewhere between 7 and 12 minutes during a session with 18 patients. Now, that's still helpful for sure, but it's a very different picture than the 22 minutes we just saw. But, this story isn't just about saving minutes. It's also about the human connection. In one large pilot study, a staggering 81% of patients said their doctor spent less time staring at a computer screen. That is a huge win for the patient experience, right? It allows for better focus and more personal, connected care. So let's pull all this together. We've got some reduced burnout, some modest time savings, and happier patients. What does this all add up to? What is the final verdict on AI scribes as they exist today? The evidence really leads to one very clear conclusion. AI scribes, in their current form, are not productivity tools. Not yet. And here's why that's such a crucial point. Saving anywhere from 7 to 22 minutes is fantastic for giving doctors some breathing room and for reducing that burnout. But is it enough time to sustainably add more patient appointments to the schedule? Not really. If you try to do that, you just erase all the well-being benefits, putting doctors right back where they started. So for now, their real value is in burnout relief, not in boosting clinic throughput. But the story does not end there, not by a long shot. What we've seen so far is really just the beginning. The true potential of AI scribes goes so much further than just the doctor's note. Because creating that note, that's just the tip of the iceberg. It's the part you can see. The real, soul-crushing, time-consuming work is everything that lies just beneath the surface. This right here, this is where the true revolution is waiting. We're talking about an AI that doesn't just listen but actually acts. Imagine it drafting medical orders right from the conversation, tackling the nightmare of insurance prior authorizations, suggesting billing codes, and even drafting follow-up messages to patients about their test results. This is the huge, submerged part of the iceberg that consumes so much of a doctor's life. And the reason AI scribes are perfectly positioned for this kind of evolution is pretty simple. They have access to the full, unfiltered context of the clinical conversation. They hear the diagnosis, the treatment plan, the patient's concerns, all of it. That context is pure gold for accurately and safely managing all those complex downstream tasks. This isn't just about saving time on one little thing. It's about automating an entire workflow. That is where the real game-changing productivity gains are hiding. Which, of course, brings us all the way back to our big question. Today, AI scribes are a powerful tool against burnout. But tomorrow, they could evolve into something so much more. And it leaves us to wonder, after decades of struggling with this, could AI finally be the cure for healthcare's chronic, debilitating paperwork problem? The potential is definitely there, but only the next generation of this technology is going to tell us for sure. Thanks for watching.